AAMG is dedicated to provide the highest quality multi-specialty medical services to patients in the San Francisco Bay Area. Come sign up to be a member today. AAMG. Your choice, your health, our mission.
The answer for using the mask is really prevent you yourself hurting yourself and from you spreading to another person and from another person spreading to you.
The CDC now recommends that you should cover your mouth and nose with a cloth face mask whenever you are around others, even if you do not feel sick, because the prior recommendations were when you did feel sick. And whenever you go out in public, you probably should wear a cloth face mask, all right? Go to the grocery store, anywhere else, you should do that. The only exceptions are if you're less than 2, because kids less than 2 can't get the mask off, or if you're incapacitated in some way that you won't be able to get the mask off yourself.
Coronavirus, COVID-19, that causes the disease COVID-19 are due to droplets. A lot of time when we speak, when we talk, when we sneeze, these droplets, the virus actually are carried on by these droplets and spread to our surfaces, our doorknob, our hand, our arms, all over the place. And when we touch ourselves, touch our T-zone, our eye, nose, and mouth, and we get infected that way. So in the beginning of the outbreak, we tell everybody, do not wear face masks. Only if you're sick, when you're sneezing, when you're coughing, you should wear face masks. However, the last few weeks, more research shown that actually a lot of patients actually infected by this novel coronavirus and have no symptoms. CDC thinks up to about 25% of the populations are asymptomatic and they carry the virus and they don't have any symptoms. Furthermore, there are some people who are pre-asymptomatic, meaning they have no symptom yet, but they're infected and they can spread the virus just like the asymptomatic patients. And actually the study have looked at the first 48 hours after they infected, they have no symptom, but they shed a lot of virus. They are very infectious. Compared to the SARS back in 2002, they are not as infectious until they get sick. 7 to 10 days, the virus peak at that day. Those days. So that's why this new coronavirus that causes COVID-19 are so infectious, because there are a lot of people, they are infected and they don't know it.
This is a common available mask on the street. There's a blue color, there's a pink color. They are the same. You can make as many beautiful colors as you like. They work all the same. The idea is to prevent you from using your dirty finger, touching your nose, picking your nose, so to speak, or putting it in your mouth. And by doing so, you prevent your dirty finger from spreading the virus into your mucous membrane, which can be in your nose, in your mouth, as well as in your eyes. So the first function of this is to prevent you self-inflicting on yourself the infection. Now we go to more sophisticated surgical masks that we used to wear in the hospital. These masks are divided in 3 levels. This is a level 1 mask in blue color, a level 2 mask in orange color, and this one is a level 3 mask with a face shield, okay? The color means nothing. I can make this pink if I want to, the manufacturer make it pink. But when they tested it, each one of them, the level 1 will not able to withstand the pressure of spraying of blood or body material into the mask and infected us. This basically is a different density mask for helping us from getting the backward spray of our patients back to our face. But none of this level 1, level 2, or even level 3 mask will prevent this from us getting the COVID-19 virus. It's the N95 mask that's important for preventing the COVID-19 virus spreading. N95 means 95% of the micro bacteria, virus can be really filtered out, okay? However, if myself or my patient deposits some droplets on this mask, or if I sneeze into this mask, the filter capability will decrease to the point it's almost become useless. That's why in a situation where we work with patients with COVID-19, we wear this kind of mask, N95 mask first, and then wear an outer shield like this to prevent our mucous membrane and added material so that if this first one gets wet, at least we are still protected. Of course, we can protect if we sneeze into the mask. As soon as this mask becomes wet, the filtering capability will go down tremendously. So we have to basically throw this away and wear a clean, dry one.
So here's the CDC's recommendation from their own website. And I really like how they did it. 3 different ways. One is that if you have sewing machine, you can sew it by finding some cloth. You know, this is the design, and then you sew it together. So it's really quick. And another one is really quick. You can use t-shirt. Literally, you can cut it in a minute. So you cut it, and then you take out 6 to 7 inches out, and then create the strength so you can tighten. If you think it's too thin, you can add some layers. So finally, this is the last one. This is actually using a 20 to 20 bandana. In addition to that, you need a coffee filter and a coffee filter, and put it in the middle, and you fold it, make 2 folds, and then you add the rubber band on the left and right side, and then you fold a little bit, and then boom, you actually have created a mask for yourself. I created my homemade mask. I used some towels, like 10 by 10. So I just fold it in 3. I make 2 folds, and then I added this metal string. I added inside to create the contour for my nose, and then I just rub around. So this is how I rub around, and then I contour the metal string, and then fit it around my nose, so creating a seal. So this is really easy. In 1 minute, I create a homemade mask, and then this one, my mom actually sewed it for me. So you create a little pocket inside. You can put some paper towel inside to create another layer if you want. And then you can actually still wear it like this. And then she added a little string inside here and then create a contour. So completely seal.
So my advice is, in general, if you're using it to go out to buy grocery and practice separation, might as well make your own cloth mask or buy $1 each. Don't spend a whole lot of money buying expensive mask. And if they get wet, throw it away. You make your own cloth mask, use some bleach, water, wash it, dry it, and then use it again next day. They are same. They are just the same.
For more information on other health topics, please visit the AAMG Health Education website. If you like this video, please give a like and subscribe to our channel for more related content.